She's getting red.
You're gonna shoot her.
3 years ago in November, my grandmother died from a disease called Alzheimer's, which ravaged her brain. The 6th leading cause of death in the United States is Alzheimer's disease. One of the most common forms of dementia, Alzheimer's disease causes problems with memory, thinking, and behavior. 50 to 80% of all dementia cases are people with Alzheimer's. Alzheimer's disease is a form of dementia which causes memory loss and is fatal. The greatest known risk factor of Alzheimer's disease is increasing age. The majority of people who have Alzheimer's disease are 65 or older. However, Alzheimer's is not just a disease for the elderly. 5% of the people who have Alzheimer's have early onset. This means that the disease usually appears between the ages of 40 and 50. Scientists have been able to tie most early cases of Alzheimer's to genetics, whereas the late onset Alzheimer's is random. Long before the first sign of memory loss appears, microscopic changes occur in the brain. According to scientists, Alzheimer's disease prevents part of a cell's factory from running well. Scientists are not sure where the damage starts, but breakdown in one system messes up the others. Cells lose their ability to do their jobs as damage spreads and eventually die, causing irreversible changes in the brain. Difficulty remembering newly learned information is the most common symptom of Alzheimer's disease, because Alzheimer's changes usually occur in the part of the brain that affects learning. Alzheimer's leads to severe symptoms as it advances through the brain. Some of these symptoms include mood and behavior changes, unfounded suspicions, disorientation, difficulty swallowing, difficulty speaking, difficulty walking, and memory loss. Symptoms of Alzheimer's become severe enough to interfere with daily tasks. In the early stages of Alzheimer's, memory loss is mild, but in the late stages, individuals lose the ability to respond to their environment and to carry on conversations. Mother, will you come up and hold this picture for me, please? Okay, so this is a normal brain without Alzheimer's. This is a brain with Alzheimer's, and then the faded one behind is the healthy brain, and then this is the Alzheimer's brain, and you can see the difference between the two of them. Callie? Okay, this shows early onset, middle onset, and late onset. As you can see, it progresses through. Okay. There are two abnormal structures called plaque and tangles that are responsible for damaging and killing nerve cells. Plaque are deposits from a protein formation called beta-amyloid that builds up between the nerve cells. Tangles are twisted fibers from another protein called tau that builds up inside cells. Plaque and tangles are most likely developed as people age. However, people with Alzheimer's develop many more. These develop in a particular pattern beginning in areas important for memory before spreading to other parts of the brain. Experts believe that communication among nerve cells is blocked by tangles and plaque. They also believe that tangles and plaque disrupt cell processes that cells need to survive. Memory failure, personality changes, problems carrying out daily activities, and other symptoms of Alzheimer's are caused by the destruction and death of nerve cells. Dad? Come on up and hold this paper for me, please. Okay, so this is a picture of the plaque and tangles that occur in Alzheimer's cells, and these are healthy cells. As you can see, these buildups. There are many changes that occur through Alzheimer's, and these changes come at different stages. The early stage includes losing things, forgetting words, having a hard time carrying on a conversation, having problems with words, and getting lost in places that they know well. Some middle stage changes consist of the person needing help bathing and getting dressed. They also need help cooking, shopping, and paying bills. Once the person with Alzheimer's gets to the middle stage, they can no longer drive. During the late stages of Alzheimer's, the patient needs 24-hour care and needs help sitting and standing. The patient also may communicate through pointing or using short words, and they may not remember family members. Alzheimer's has no current cure. However, today Alzheimer's is at the front of biomedical research. There are 5 million people in the world that have Alzheimer's, and 15 million people in the world are caregivers for someone with Alzheimer's.
I think we should do
The current Alzheimer's treatments cannot stop Alzheimer's from progressing. However, it temporarily slows the worsening of the dementia symptoms and improves the quality of life for people with Alzheimer's and their caregivers. At this point, scientists have found 5 medications to help treat the symptoms of Alzheimer's disease. These medications are Aricept, Razidine, Namenda, Exelon, and Cognex. Scientists are also working on ways to diagnose people with Alzheimer's earlier so that future treatments can target the disease before irreversible brain damage takes place. Experts are working to uncover as many aspects of Alzheimer's and related dementias as possible. In the last 5 years, we have learned 90% of all the knowledge that we now have about Alzheimer's. Another question has been raised while experts are trying to find ways to cure Alzheimer's. Can Alzheimer's be prevented? Studies show that 80% of people who have Alzheimer's also have a cardiovascular disease. Experts believe that controlling cardiovascular risk factors may be the best approach to protecting brain health. Physical exercise in the person's diet is also believed to possibly prevent Alzheimer's. Evidence says that exercise may benefit brain cells by increasing oxygen in blood flow. However, it also helps because of its benefits to cardiovascular health. Also, evidence shows that if a person eats a heart-healthy diet, such as a Mediterranean diet, that will help prevent Alzheimer's disease. Another prevention is keeping socially active and mentally active as aging occurs. There also appears to be a strong link between head trauma and Alzheimer's disease. Alzheimer's disease will kill 450,000 people in the year 2013 alone.
Is it like a